Types of IV contrast used in MRI by Kayla Norris. Contrast agents for IV. There are 3 contrast agents that our Washington and Lever book lists as IV contrast agents. They are aloxate meglumine, aloxate sodium, and ioxyl. So contrast agents for MRI specifically, I can only find one contrast agent used via IV for MRIs, and that is glidonium contrast media. It's used specifically for MRI and is administered intravenously. Glidonium contrast are chemical substances used in magnetic resonance imaging (MRI) scans. When injected into the body, glidonium contrast media enhances and improves the quality of MRI images. This allows radiologists to more accurately report on how your body is working, whether there is any disease or abnormality present. Continuing on for contrast agent via IV for MRIs, the glidonium contrast media consists of a complex molecule arrangements of atoms held together by chemical bonds. The chemical bond is made between the glidonium ion and the carrier molecule. The contrast media is injected intravenously as part of the MRI scan and is eliminated from the body through the kidneys. Using the glidonium contrast media improves the diagnostic accuracy of MRI scans. It also improves the visibility of inflammation, tumors, blood vessels, and for some organs, blood supply. And here is my reference page.
Indications for use of contrast agents in MRI. Gadolinium contrast medium. It increases the signal from tissues where there is increased blood flow, particularly in a setting of inflammation or neoplasm. Improvement in the contrast between normal and pathological tissue is often much higher than that of the iodinated contrast at computed tomography. It is useful in suspected inflammatory joint disease, inflammatory bowel disease, and inflammatory and neoplastic conditions of solid organs such as the liver and kidney. It enhances and improves the quality of the MRI images. It is used in about 1 in 3 of MRI scans to improve the clarity of the images of the body's internal structures. It also improves the diagnostic accuracy in some conditions such as inflammatory and infectious diseases of the brain, spine, soft tissues, and bones. In this picture down here, you can see MRI of the brain before the injection and after the injection, and you can see the tumor a lot more clearly. And there is Magnifist. It is a gadolinium-based contrast agent indicated for intravenous use in diagnostic MRI in adults and children 2 years of age and older to facilitate the visualization of lesions and abnormal vascularity in the central nervous system, so the brain, spine, and associated tissues, the extracranial, extraspinal tissue, so the head and neck, and the body. And that is it.
Hi guys, it's Avery. This part of the presentation is on contraindications of contrast agents used in MRI. First, let's start with what contraindication means. A contraindication is a condition or factor that serves as a reason to withhold a certain medical treatment because of the harm it would cause the patient. Essentially, it means that surgery, drug, or a procedure should not be used because of the possible harm coming from it, due to a pre-existing patient's condition or factor. Contraindications are taken note of because it ensures safety of the patients. If a patient has a pre-existing condition that could affect the outcome of the use of a contrast agent, it is important to take note of that and not use that contrast agent. There are different contraindications for specific contrast agents used in MRI. However, this slide touches on some general contraindications that would be looked at before giving the patient the contrast agents. Some examples of these general contraindications are pregnancy, allergic reactions to the contrast, renal disease or deteriorating renal function, or no IV access. All of these examples could bring a red flag to the healthcare professional prior to giving the contrast agent. This could prevent serious issues in the patients that have or are or fall under any of these examples. MRI contrast agents are used to improve the visibility of body structures inside the body before the MRI is done. The contrast agent that is often used in MRI, as Kaylin talked about, is gadolinium contrast media. All of the contraindications talked about in the previous slide also apply for gadolinium contrast. However, the main contraindication that comes with gadolinium-based contrast agents specifically is severe acute or chronic renal failure, specifically with a glomerular filtration rate less than 30. This has a risk of nephrogenic systemic fibrosis, or NSF. NSF is rare but also a serious systemic disease. It is characterized by fibrosis of the skin as well as other tissue throughout the body. Avoiding this is a very important thing to do for all healthcare workers that are involved with that patient. That brings us to the end of my part of this presentation. Thanks for listening and learning about contraindications of MRI contrast agents.
Cancer, Bell's palsy, seizures, known acoustic neuroma, prior surgery for acoustic neuroma, report of pituitary adenoma tumor, abnormal prolactin, galactorrhea or amenorrhea, history of visual disturbances, ptosis, optic nerve, soft tissue neck, and a mass in the neck, Next, an MRI would be used in the spine for the following situations. For the cervical spine, multiple sclerosis, spinal tumor infection or cervix. Thoracic spine, multiple sclerosis, spinal tumor infection, cervix or previous surgery within the last 5 years. The lumbar spine, spinal tumor infection, cervix, or post-operative spinal surgery. Other parts of the body include, first off, the chest. MRI would be used to evaluate mass or pain, rib cartilage or diaphragm. These could all include masses. Next, the abdomen includes tumor, liver, or pancreas evaluations would be when an MRI would be used to evaluate. Also for the liver, pancreas, and renal, which is known as the kidney, this includes like any mass, any palpable masses or pain. Next, the pelvis would be used for pelvic pain, mass, or surgical planning for radiation therapy. This could also, patients could complain of pelvic pain, palpable masses, surgical planning, again, gynecological abnormalities, but to be used for any type of female pelvis. Next, the renal, report of a renal tumor, kidney tumor, or mass. Next, the breast, history of breast cancer, abnormal diagnostic mammograms, abnormal diagnostic ultrasounds. This includes and requires recent mammogram study. Typically, when the previous mentioned items are ordered, they are ordered with and without contrast. Likely 2 images will be taken, one with contrast and one without, to compare the 2 images. And as I described all the different anatomy parts, I described when an MRI would be used with contrast. Lastly, I'd like to describe these images that I have here on my wall. This is an MRI of the brain. You can see the no contrast and after IV contrast is used in the brain, and you can see this tumor show up in the brain, as before it did not show up without the contrast. Next, we have the breast. This was an interesting photo that I found, because this shows a normal mammogram, what it should look like. And this over here in the middle shows the MRI image before the contrast. And over here, last image shows the MRI image after contrast, which shows a tumor light up. Over here, I have an MRI used with contrast of the abdomen. You can see the kidneys, the liver, the spleen over here, and then you can see, I'm not sure what they're, they're just looking. I don't know if it's a routine or what, but you can see when the contrast is used how much of a difference that can make. Lastly, over here I have a page of a couple of references that I used for my presentation. Thank you all.